Hi, everyone. My name is Dr. David Duong. I am a primary care physician and also on faculty at Harvard Medical School. It is my honor to be with you today as a keynote speaker for the Korean Academy of Primary Healthcare Winter Meeting in 2020. I am sorry that I cannot join you in person due to the COVID travel restrictions. However, I look forward to the day when we can be in person together. Today, my talk to you will be on reimagining the future of primary healthcare for Korea and for the world. I would also like to talk about the partnership between Harvard Medical School and the Korean Academy of Primary Healthcare. I am currently the director of the program in global primary care and social change here at Harvard Medical School. I have no financial conflicts of interest to report. The objectives of my talk today will include reimagining primary healthcare for the future, introduce the Harvard Medical School Center for Primary Care and the program in global primary care and social change, highlight select activities that have made the Center for Primary Care at Harvard Medical School successful, and share with you our hopes for a future collaboration with the Korean Academy of Primary Healthcare. So primary healthcare in the global context is now more important than ever because of the push for universal health coverage, which was made apparent at the UN General Assembly in 2019. Also, the World Health Organization, UNICEF, and over 130 country governments, including Korea, signed on to the Declaration of Astana in 2018 in Kazakhstan, reaffirming the country's commitment to primary health care. Also, the Sustainable Development Goals, and specifically Sustainable Development Goal 3 to ensure good health, require each country to build a strong foundation of primary health care. So why do we need to build a strong foundation for primary health care? We need to look at the evolution of our healthcare system in order to understand. First of all, regarding disease burden, we have gone from acute diseases to chronic diseases that extend over many years and across the lifespan. Patients need to be taken care of in a longitudinal manner, and the best way to do that is with primary care, to prevent disease, to diagnose disease, and also to manage disease. For example, diseases like diabetes, hypertension, asthma, chronic obstructive pulmonary diseases, and cancers all should be managed at the primary care level in order to prevent manifestations that require expensive hospital care. Or if patients are first admitted to the hospital, they should be stabilized and transferred back to the primary care level in order to manage their disease and prevent it from progressing further. When we look at the health system and the orientation of the system, we used to react and rescue. However, we need to move towards engagement with patients and engagement with care teams and the empowerment of patients. And again, this is best done at the primary care level. When we look at the role of the patient, historically, the patients have been passive receivers of care, meaning they listen to the doctor and the doctor tells them what to do. However, with a more educated population, a more connected patient population through the internet and through information, patients have become more active consumers of their own healthcare, and they want to have an active role in maintaining health. And we should do our best to promote that. And finally, when we look at the providers of the healthcare system, for example, the doctors or the nurses, previously, the best or the most highly regarded skill was the technical skill, and we wanted smart and technically good doctors and nurses and pharmacists and physician assistants. However, in the new healthcare system, we want these healthcare professionals to be able to work within and lead teams and systems rather than focusing mainly on technical excellence alone, because the accessibility and availability of knowledge is extremely available, and it's also changing. So we need to de-emphasize technical excellence and increase the emphasis on provider competencies of working within and leading teams and systems. The evolution of primary health care can be traced back many years. The vision for key primary healthcare functions in the future is to make it accessible, comprehensive, coordinated, integrated, longitudinal, and in the context of family and communities. Regarding each of these 6 domains, these are the key tenets of what the future of primary care looks like. Primary care needs to be accessible to patients, meaning close to patients in their homes. Comprehensive, meaning not just looking at one disease, but looking at the patient as a whole person. Coordinated and integrated, which means that it needs to be coordinated and integrated within the entire healthcare system, from the primary care level to the hospital level and back to the primary care level, and also include key public health functions. This is extremely important, especially in the era of COVID, when we understand and realize how necessary it is to coordinate closely public health functions such as disease detection, surveillance, contact tracing, and quarantine with medical functions. Primary care also needs to be longitudinal, which means to say that healthcare needs to follow the patient through the entire course of their life and be connected. And finally, it needs to be in the context of family and community and close to where the patients are. This is especially important as countries such as those like Korea and in Asia Pacific have rapidly aging populations. Therefore, care in the community and care at home is most desirable. Currently, primary care now is what we would consider first contact or first level, meaning in some countries, like here in the United States, it is the first time people see a physician, or it's the first healthcare provider that people go to. It's usually a doctor or a nurse, not a team. It's usually in a clinic. It's sometimes seen as a gatekeeper to specialty care. And in many countries, primary care is seen as basic care or inferior care. We need to do our best as primary care providers to change this narrative. By 2030, we have a new vision for primary care. We envision that primary care will serve as the main point of entry into the healthcare system for the majority of health problems and provides proactive delivery of key preventative services to populations and manages chronic conditions over time. We envision it to be a continuous, people-focused, and comprehensive, addressing health needs of all members of society across the life course, and may include integrating and coordinating with secondary and tertiary levels of care. This is extremely important because in countries such as your country of Korea, where most of the care is sought with subspecialists in hospitals, the cost to the healthcare system is growing exponentially, but the benefits to the population health may not be equivalent to how much it costs. We know that a primary care first approach and a primary care centered health system will decrease costs, but also increase health outcomes at the patient level and also at the population level. When we look at primary care, we really look at the two most exciting areas is how to use information technology and the role of patients. Currently, information technology or data is used to report up to higher levels. It requires extra labor or diverts existing labor, for example, documenting in the electronic medical record, and it's focused on quantitative diseases or intervention targets. What we envision data usage and information technology use by 2030 is that technology enables team-based care and leverages digital tools and non-physicians to provide care. This means combination of in-person visits and also telemedicine visits via an application, a phone, a computer, a handheld device to make care as easily accessible for patients. It drives continuous improvement and learning at point of care. Data is collected passively as a part of the care process, shared seamlessly and transparently, captures dimension of service and system performance, and fuels advanced analytics so that we can make population health level decisions, but also so that it can be given back to the patients to empower the patients on their own health care. Secondly, the current person or patient that engages in healthcare is currently passive recipient of a technically complex service. They are seen as lucky to be able to receive any care. In the Asian cultures, we notice that they should be quiet and follow directions, and they're seen as either compliant, meaning they follow the doctor's directions, or they're non-compliant, meaning they don't follow the doctor's directions. The person and patient by 2030 is an essential partner in care processes and outcomes. This means that they will partner with the care team in order to have shared decision-making based on their life and the factors that exist in their life. They're a critical producer and consumer of data and other health information. And if constrained by structural barriers or health challenges, they may require additional support to adhere to, meaning that the patient may require additional support using technologies or additional healthcare providers to help them adhere to certain medical regimens, but they're a partner in those decisions. So the Center for Primary Care at Harvard Medical School has been really a leader in trying to enable and work towards a vision of primary care by 2030 that I just shared with you. And our vision right now at Harvard Medical School Center for Primary Care is saving and improving lives through primary care. Our research shows that more primary care saves and improves more lives. Our mission is to promote and support primary care resilience, equity, and value in order to improve health and well-being for patients and for entire populations. Our core values include social justice, innovation, advocacy, collaboration, sustainability, and discovery. So our areas of focus include 5 areas. The first is education. We create primary care curriculum for students, for residents, and for current physicians. For current physicians, we offer executive education courses. And this is not just for current physicians, but also for nurses. This is for clinic managers. This is for pharmacists. We want to promote a team-based care approach to delivering primary care. And we do this through curriculum for students, residents, and for primary care providers through our executive education courses. We also work in the area of innovation, and we have boot camps and health tech fellowships that are in campus in Boston to help promote innovation, discovery, and the creation, for example, the creation of new technologies and new companies to promote primary care. Regarding our research, we have studied over 34 primary healthcare systems around the world and have written them up as exemplars or otherwise best practices in primary care in Harvard Business School style cases that we teach, but we also share. We have over 100 publications in top academic journals regarding different aspects of primary care, including primary care design, primary care reform, primary care training, and primary care policy. Our systems transformation work involves transforming over 50 primary care practices and health systems to orient towards primary care, both in the US and globally. And then finally, I want to discuss our global health and engagement as another area of focus. So our global health and engagement comes through our program in global primary care and social change. We have 4 areas in which we work on. The first is accelerating the development of sustainable, reliable primary care systems. The second is advancing health equity and access to primary care for communities around the world. The third is fostering public, academic, and private partnerships to increase access and innovation in primary care. And the fourth is to expand our research portfolios, collaborations, and resources for medical students and primary care providers through our executive education work. Our goal in the program in global primary care and social change is to play a catalytic role in the global effort to achieve universal health coverage by 2030 by building on this global movement and this excitement around primary health care. Our current partners include the World Economic Forum, the World Health Organization, the World Bank, as well as private sector companies like Novartis, countries like those in Vietnam, and other academic institutions such as the National University of Singapore in Asia Pacific. These are just some of our partners, not all of our partners. And we really look forward to partnering with the Korean Academy of Primary Healthcare moving forward. In terms of our research, we do original research on primary care systems. We have expert consensus documents, white papers, and recommendations on how to achieve universal health coverage through a patient-centered approach or through disruptive primary care models with private sector. And most recently, we will be publishing a book on the Asia Pacific experiences of primary healthcare in the COVID-19 pandemic and how primary healthcare has helped control COVID-19 in the Asia Pacific region. Regarding training, we develop primary care curriculum for undergraduate and graduate medical education. So that means both residency and medical students. We train current primary care doctors, nurses, and pharmacists on team-based care models, because the team-based care model is shown in research and in the literature to be the most effective way of delivering primary health care. We train health systems leaders on primary healthcare planning and investments. So for example, for country governments that want to transition to a model that is focused on primary healthcare or a healthcare system that is has a foundation of a strong primary healthcare system, we will work with ministries of health, ministries of planning and investment, ministries of finance in order to train them and then develop country strategies. We also host global webinars on new topics and trends and updates on primary healthcare design and innovations and current problems or current challenges and opportunities that primary care faces. And then we have a really large global community of primary care experts and researchers and innovators. On the screen are just a small collection of those in our community, and they come from Asia Pacific, from the United States, and from around the world. I would also like to take this opportunity to share with you our primary healthcare visiting scholars program at Harvard Medical School, where we bring visiting scholars from around the world to Harvard Medical School, both virtually and in person. It's a half-year to a one-year program. There's mentored research and learning as a part of the visiting scholars. And then you also have the ability to connect with global primary healthcare experts around the world and in the US to advance the primary care agenda in your country and at your institution. And we hope to welcome scholars from Korea in the very near future. So for the relationship with the Korean Academy of Primary Healthcare in Harvard, we are extremely excited to have signed an MOU, a memorandum of understanding between our two institutions in November of 2020. This memorandum of understanding will allow us to explore opportunities for joint research activities, including Korea-specific research, cross-Asia Pacific analyses, as well as US comparative analyses with the Korean system. We also hope to exchange students, professionals, and scholars between Korea and Harvard. We also hope to have training opportunities in Korea at Harvard and also online in the areas of community health, primary healthcare workforce strengthening, primary healthcare innovations, and health system strengthening in general. We hope to have Korean experts come to Harvard and Harvard experts come to Korea and vice versa to engage in these joint training opportunities. And finally, we would love the opportunity to engage with the Korean Academy of Primary Healthcare, as well as with leaders in the Korean health sector on what it will look like to develop a strong primary healthcare strategy for Korea to enable increased access to healthcare services in an effective and equitable and most cost-efficient manner. Because we know that there are many, although there are many great things about the healthcare system in Korea right now, one of the biggest challenges is the use of hospital medicine and the use of subspecialty care. And we would love to partner with you on coming up with a strategy to increase the role of primary care in Korea. That is the end of my presentation. Thank you very much for your attention. And once again, I hope to meet each and every one of you in person in the very near future, either when I travel to Korea next, or when I get a chance to welcome you to Harvard Medical School. Once again, it's been an absolute pleasure, and I look forward to hearing from you. Thank you very much.